3D printing is without a doubt one of the most heated technologies in recent years. And maybe no other industry is currently adopting 3D printing more quickly than dentistry. By combining cutting-edge technologies such as 3D printing, oral scanning, and CBCT, the age of digital dentistry has come to us. Now, with an intraoral scanner, dentists can easily import the intraoral information into the planning software to generate a virtual model. This allows the dentist and the dental technicians to design the restoration in a much more efficient way. What's more, the proposed outcome can then be quickly printed with 3D printer and shown to the patients. Orthodontists can also make good use of these technologies to better inform patients about the outcomes while recording the movement of teeth during the treatment. Because unlike conventional impressions and cast models, the brackets and lines won't be a problem in front of oral scanner and 3D printer. However, the most exciting thing is that when the CBCT data and scanned data are fused together, a virtual model containing anatomical information can be obtained. With this model, dentists can well plan the placement of their virtual implants and print their drilling guides before the surgery. This really changes the rule of the game, because in this way, even the inexperienced dentists may precisely place the implant into the ideal place, which means a lot of implant complications and compromised superstructures can be avoided. We believe that in dentistry, 3D printing will play a more important role in the near future, and the only thing we can do is to get ready for it.